Imagine unlocking the stories that numbers can't tell. Imagine delving into the why and the how behind human behavior and experiences. That right there is the beauty of qualitative research. It's like being a detective, but instead of solving crimes, you're uncovering the rich, complex layers of human experiences and perceptions. Now, if qualitative research is the detective, then thematic analysis is the magnifying glass. It's a method used to identify, analyze, and report patterns or themes within the data. It organizes and describes your data set in rich detail and often interprets various aspects of the research topic. Think of it as the tool that helps you sift through the sand to find the gold nuggets of insight and understanding. Let's take a hypothetical case to illustrate this. Suppose you're exploring the experiences of people living with chronic illness. You've conducted in-depth interviews, and now you're sitting with a mountain of transcripts. Where do you start? Step 1. Familiarize yourself with the data. This involves reading and rereading the data, noting down initial ideas. For our case, you might notice recurring words like isolation, fatigue, or resilience. Step 2. Generate initial codes. Codes identify a feature of the data that appears interesting to the researcher. In the chronic illness case, you might code feelings of isolation, physical symptoms, or coping strategies. Step 3. Search for themes. This is where you start to analyze your codes and consider how different codes may combine to form an overarching theme. Perhaps isolation, lack of understanding from others, and desire for connection could combine to form a theme of social struggles with chronic illness. Step 4. Review themes. Check if the themes work in relation to the coded extracts and the entire data set. In our case, does the theme of social struggles fit with the coded data and the experiences expressed in the interviews? Step 5. Define and name themes. Refine the specifics of each theme and the overall story you're telling with your analysis. For instance, social struggles might become navigating social landscapes in chronic illness. Step 6. Produce the report. This is where you weave together the analytic narrative and data extracts and contextualize this in relation to existing literature. Now, the beauty of this process is that it's not just for public health research. Whether you're studying education, sociology, marketing, or any field that involves understanding human experiences, you can use qualitative research and thematic analysis. So why not give it a go in your next research project? Remember, at the heart of it, you're telling the story of your participants. Your role is to give voice to their experiences and perceptions. It's a powerful and rewarding process, and the insights you gain can truly make a difference. So go forth and uncover those untold stories. Happy researching!